The first school district in North Carolina demanding lawmakers change state COVID protocols.
The fight over whether to keep or modify coronavirus policies in schools is playing out in Union County tonight. School board members voting just moments ago to call upon state health leaders to end COVID-19 contact tracing that's done by school nurses. They also want the state to stop the quarantine requirements for when someone in the classroom tests positive for the virus. WCNC Charlotte's Brianna Harper joining us now live from Union County to explain the difference in opinions leading up to this decision. Bree.
Yeah, Vanessa, ahead of tonight's Union County School Board meeting, there was some division among parents about whether or not quarantine and contact tracing guidelines should stay or should they go. But ultimately, it was only a single vote by board member Reverend John Patrick to not approve that resolution. The support, however, came from the majority of the school board members as well as the Union County commissioners, who all agree changes are necessary when it comes to isolation and contact tracing throughout schools. In a shared resolution, the two groups are asking for the state to reconsider its COVID guidelines to help eliminate large numbers of students from missing school, while also helping to successfully control the spread of the virus. The county and school district is asking that the changes to end contact tracing and quarantine be effective before students return for the second semester beginning January 19th next year. Tonight, some parents spoke in support of the resolution, while others shared concern.
Step in the right direction, and I'm so proud of Union County for being leaders when it comes to challenging the draconian quarantine rules that have burdened us all.
And all that does is put all of these kids and their families in danger. Now they're not even going to know when they've been exposed. They're going to take it home to their grandparents, aunts and uncles. That's going to spread through the community. It's a terrible idea.
And Union County Schools is also hoping other school districts might support the resolution and hope to influence the state's decision. Meanwhile, those parents who were opposed to the resolution say tonight's vote, although it did not go in their favor, they are still confident that as they continue to voice their opinions, they will be heard. Fred?
Bree, this vote tonight, more symbolic, right? The school district isn't really ending its coronavirus safety protocols.
Yeah, that's exactly right. And that is one point that the school board members really wanted to drive home. This vote is simply asking the state to make those guideline changes by January. But tomorrow, the protocols that are in place will still be there until those changes are made. Reporting live tonight in Union County, Brianna Harper, WCNC, Charlotte.
Bree, thank you.
And so, yeah, we wanted to put this decision into context tonight. There are two things to know. One, the new Omicron variant is rapidly spreading across the U.S. You can see this latest map here showing the variant is essentially popping up in just more and more states by the day. Officials saying it is only a matter of time before Omicron is officially confirmed in North Carolina. So you might be wondering, where does North Carolina sit with the coronavirus in general at this point? Wanted to focus on hospitalizations. And this is a graph here you can see showing the peak. This is the most recent surge that we saw in COVID-related hospitalizations. So you can see that was around mid-September. The number of patients dipping then as we headed into the earlier part of November, as low as about 1,000 at one point. We hit that mark around November 13th, but you can see we are starting to creep back up again. So since then, since that most recent low point, we've seen hospitalizations go up by 344 patients. And get this, 216 of those patient gains have been just in the last 7 days. Keep in mind, hospitalizations are what doctors point to as signs of another surge and an important measure of the virus's burden on our community.